I'm Dr. Lora Shahine. Welcome to my YouTube channel. Today, we're going to talk about exercise and IVF. I'm Dr. Lora Shahine. Welcome to my YouTube channel. I am a double board certified reproductive endocrinologist, helping people build their families for over 15 years and answering the question, how much can I exercise during IVF? It's a very common question. Exercise is important. It is a part of your physical and mental health. But so often people are told, if you're doing IVF, stop exercising completely. And I actually don't think that that's right. That's not what I tell my patients. Of course, you need to talk to your doctor about your personal situation, but let me explain a little bit more about fitness and fertility and IVF. For a full background and even more research on fitness and fertility, go to my other YouTube video titled Fitness and Fertility and learn a lot more about it. In that video, I really am going over how there's got to be a balance. A sedentary lifestyle, no matter what weight you are, if you're not moving your body, that's associated with infertility. And if you have too much strenuous exercise, if you're really pushing your body to exhaustion, that's not ideal for your reproductive health and fertility as well. There's got to be somewhere in between. And patients get stuck in the middle of trying to understand what is best for them. So let's talk about it. So when a patient asks me, well, how much exercise is too much? I want to look at the data. So there's one study published in 2006 in the journal Obstetrics and Gynecology, looking at over 2,000 women in the Boston area that were reporting on exercise routines in the few years leading up to their IVF cycle. And in this one study, it did show regular exercise did not impact outcomes of IVF, but women who reported routinely more than 4 hours of vigorous exercise in a week leading up to their IVF cycle had a 40% lower success rate with their treatment. So that's pretty alarming. I started counting up how much I exercise, and I just don't think it's that black and white, because I think every person is different, every body is different, and certainly types of exercise are going to be different. So we do know from other studies that I review in my fitness and fertility video that pushing your body to exhaustion, like real vigorous exercise, can shift our body to a more fight or flight kind of stress hormone, cortisol releasing state and away from reproduction. So I don't want to tell everyone out there who's trying to conceive, don't exercise more than 4 hours a week, because that's just too black and white. But I think that you could move your body, be healthy, but maybe when you're trying to conceive, and certainly when you're in your IVF cycle, you want to modify. So what about during the IVF cycle? Why do people say don't exercise? In an IVF cycle, the reason sometimes people are told not to exercise at all is that your body is working hard on recruiting all those eggs, and there is a small risk of something called ovarian torsion. Let me explain. In an IVF cycle, you are recruiting more eggs than you would naturally ovulate without these shots or gonadotropins. And so if you are ovulating 10, 20 eggs, then your ovaries are going to be enlarged and working hard with developing and maturing those eggs inside little pockets of fluid called follicles. When your ovaries are enlarged, they're at a slightly higher risk of torsing on themselves. So the ovaries are actually attached to the sidewall of the abdomen and the uterus with little ligaments. So if the ovary twists on itself, then it can cut off blood supply to the ovary, and it can be very painful, and it can be a medical emergency. It can require a laparoscopic surgery to untwist the ovary. This is really, really rare. This happens in 0.03% of IVF cycles. I looked that up, and here's the reference. And so it's something to talk about, and you are at higher risk of ovarian torsion when you are stimulating the ovaries and they are enlarged if you do vigorous exercise. So I do talk to my patients about, as you get closer to your egg retrieval, it's okay to be swimming, but let's not do flip turns at the end of the pool, right? Because you're twisting yourself. Yoga is wonderful. Stretching and moving your body is wonderful, but let's not do crazy high impact yoga, and let's not do inversions, crow and handstands and things like that. Let's move our body and get the benefits of yoga, but let's not do the inversions or where you're, flipping up. So even like downward dog, I think I would just avoid that for close to your egg retrieval. One of the biggest side effects of doing an IVF cycle is just feeling bloated and being tired. Your body is working hard. There's so much mental energy that's going into remembering your appointments at the clinic and remembering your shots every day. Sometimes my patients are like, I'm usually a night owl, and the last week I've wanted to go to bed at 7 p.m. So your body is telling you just need to take it easy. And that doesn't mean doing nothing, because I think moving your body is healthy. It's good for mental health, physical health, but you might just want to modify. So low impact things, yoga, gentle walking is great. Light jogging is probably okay, but you really might not feel like it. And so it's finding that balance. So let's recap. Exercise is important for your mental and physical health, but when you are trying to conceive, and certainly during your IVF cycle, you want to modify. There is a very small chance, but real chance of ovarian torsion around the time of your egg retrieval, when your ovaries are enlarged and recruiting multiple eggs. So that is why sometimes people are told to not exercise at all. I think it's okay to move your body a little bit. Of course, talk to your doctor about your specific situation, but I tell my patients to not completely cut out moving their body, but think about modifying, not pushing yourself to exhaustion, and not doing certain types of exercises that increase the risk of torsion, twisting, standing on your head, flip turns in a pool, that sort of a thing. So I hope this video was helpful. It's answering one of the most common questions I get as a fertility doctor. Like this video if you learned something, comment with questions that you have, other topics you want me to cover, subscribe to this channel, and stick around for more learning.